Hello, everybody. Thank you for joining us today. My name is Rebecca. I'm an organiser in UNISON Strategic Organising Unit. And I'm joined today by Mackenzie from Cruse Bereavement Care, and Alice Smith, who is Assistant Branch Secretary at the University of West of England branch. And we're going to be discussing a really important topic about mental health of workers during this really difficult time. And we're here during Heart Unions Week, which, as always, is a week to kind of gives us an opportunity to talk about the great work that unions are doing at this all of the time, year round, and how unions are so vital still to working people and the work that we do every day to support our members. I think with that in mind, it's a really important time for us to reflect on this difficult year, the difficult year that workers have had, and that many are still continuing to go through. The impact on the mental health of workers has been really, really incredible this year. And we know that workers will continue to go through that as this crisis and this pandemic progresses. And so we're going to hear first from Christine. Christine has been leading the Cruse Bereavement Care courses, training sessions that we've been offering to members throughout this pandemic. She's spoken to over 300 members so far, and we'll be speaking to many more as the courses continue in the spring. And then we'll be coming to Alice. And Alice's branch have been doing some amazing work, bargaining and negotiating around mental health policies. And so Alice is going to speak to us about some of the things that she's learned through this time, about how they're preparing to move forward with more bargaining work, how they're bringing members into this process. So thank you both for joining me. As ever with these things, the technology might not be amazing, but we're going to try our best and we're going to keep going. So yeah, thank you both for coming, and thank you everyone who's joining us and watching. So Christine, I'll come to you first. Could you just tell us a little bit about yourself and about Cruse Bereavement Care?
Yes. Okay. So thank you, first of all, for asking me to join. It's always lovely to meet other people in this techno world that we're all living in now. So I welcome all of you. So I've been very fortunate through this pandemic to be have the opportunity to deliver these bereavement care webinars. These are the courses that we would deliver face to face. And we transferred onto technology like most people did around April, May time. Cruse Bereavement Care is the leading charity for bereavement in the UK. Now, it's by no means the only one. There are many, many other charities and organisations out there who work incredibly hard and well in the same way that we do to support people through their bereavement. We've been around since about 1959. We're very community-led. And it's not a counselling service. We would call it more an active listening service. And the idea is that clients get one-to-one support and they are able to find a place where they can untangle those tangles that come with managing their grief and bereavement. And the training is really an extension of that. What we recognised some time ago was the need that was out there for organisations to look at mental health in a more distinct way. So selecting specific items underneath that, and bereavement was one of them. And so part of my job was going out and delivering what I'm doing now face to face, which was always really enjoyable and a really good opportunity to understand what organisations are doing, what charities, public organisations, private organisations are doing around how they manage mental health in general, but also how they manage the bereavement in the workplace. It's one of those subjects that will be somewhere in an HR policy and will have something about what people can and can't have, but the humanness of what happens when somebody dies and how we manage that, that's the piece that many organisations are finding that they're struggling with. So way back in April, when we were asked to develop webinars for a number of organisations, Stevie and Teresa got in touch with us from UNISON, and we had a really good conversation over a few days, really, trying to think about what your members' needs might be. And so they identified a set of members. The care workers were one, health and social care, the workers in schools and colleges. So there was a kind of distinct groups of people that they were looking at. And so we developed what we would call a suite of training programs for each of those. So that all sounded really good, but actually what happened was really interesting, because we made an assumption, all of us made an assumption, that the care workers, particularly in that sector, would have the biggest need. And yes, that was true, but what we didn't bank on was that they were in the midst of a crisis, and to ask them, even though it's only 2.5 hours, to ask them to give that 2.5 hours up whilst they were literally neck deep in the crises that they were dealing with, it was too much. So we opened the sessions out, and what we found was that it was many, in the early days, it was many more of the health and social care sectors, so social workers, school workers. And then that led on to some thoughts about supporting specifically within those groups. So we created programs around children and young people, which we delivered right across the board. What was interesting, I think, for me was, although we'd created this kind of suite of product, what we were finding was that many of the people were from different sectors when they were coming in. And it was such a privilege for me to do this work, because well, first of all, I live where I live, and it would have been so easy for all of us to get together, because they were all from all over the country, all doing different jobs, all doing different organisations, all with different needs. So that was new for us as well. So trying to make sure that we met all of those needs. So it was a constant kind of round of discussions with UNISON members and with the UNISON staff to say, what do we need to tweak? For example, we went up to the north and the northwest, and they had very specific needs up there. So we kind of tweaked what we were doing. So there was a really good communication back and forth. The feedback we had back from all of our training has been absolutely phenomenal. So again, I think that just cemented this idea, Rebecca, that there was a need, and what we were able to do, working in partnership with yourselves, was fill that need, and it's still going on. It's still going on. So in total, I think, like Rebecca said, it's been over 300 people at this point, and it still carries on. So as we do one, the next ones are booked in, and then somebody from one of the branches, I was talking to one of your branch guys, I think about 2 weeks ago, because they'd heard about it on the grapevine. So they wanted to know more, but they have very specific needs. So I really think that's the interesting thing, is really understanding how to create something that is specific to the group that we're talking to. And there's some common themes and some overarching ideas. So we talk a little about what grief is, and we talk about what grief isn't, and we talk about loss in the wider sphere, and then we talk about some ideas and theories and models, and then we really start talking about the how of it. So how do you support somebody, particularly through this time? And again, as we are going through this time at Cruse, we're learning. None of us have been in this experience before, so we're having to change the way that we work. Offering our one-to-one service has completely changed, and how we and what we tend to find now is that we're talking to people in the newness of their bereavement, and that experience is very different, because they're not able to go to the funerals, or they're not able to say their goodbyes. All of those things have a massive impact on how somebody manages their loss and their bereavement. So all of that's been really interesting information that we collect as a wide organisation, and then kind of funnel it into what UNISON's needs have been. But it's been a really wonderful partnership, and a real privilege, and I don't say that lightly, but for me it's given me a greater understanding of what individuals are experiencing in their world, and how they're managing. The other thing it's done is it's allowed your members to come together in a way they wouldn't ordinarily, and it's been lovely to see that, because they're all such lovely people, and they come together and they talk to each other, and they share their experiences, and they share, this is how we do. Oh, that's a good idea. Or, have you thought about, when you talk to somebody, maybe using this phrase or that phrase, or what do you think to that? Or, as an organisation, this is what we do. So really being able to connect with them and enable them to connect with each other, it's been really lovely. And so I would say I've probably learned more than your members have at this point, about how they're doing. One thing I will say is that as the months have gone on, they're exhausted. They're absolutely exhausted, as we all are, to be fair. Using this technology to work is tiring. It's tiring to do that. Having to do that on top of having to do the shifts that you're doing and the work that you're doing. And many of the attendees who work particularly in health and social care, they're doing the face-to-face stuff, and the high stress level that's giving them. So, in thinking about what kind of things could organisations offer going forward, because at the minute they're in the midst of a crisis, they're doing it because that's what they do. They're not really thinking about it. They're on autopilot. They're getting up, doing their thing, and they're coming home, and it's all kind of very much in that vein. They're seeing far too much death, which is really hard, really hard. Even if you work in an environment where bereavement is part of your world, to see as much as they're seeing is too much, and it's overwhelming for many of them, very, very overwhelming, and it's exhausting for them to we spend a lot of time talking about self-care and finding small steps that can do to look after themselves. But I'm also very aware that they're overworked. There's far too much for them to do, and they'll put themselves last because that's what helping professions do. Parcel of who we all are when we work in this profession. But it's one of the things I'm really passionate about across all the sectors who work within those helping professionals is really the cost of not doing something to look after yourself is too great. And you won't see it today or tomorrow. You'll see it a year from now, 2 years from now, 3 years from now, 4 years from now. And then as organisations, we're thinking about how do we make sure we don't have that? How do we make sure that we don't lose the really good people because they're so sick and tired and exhausted that they physically can't do what they're doing. And it feels like that's where we're headed. So I think in terms of what organisations like yourself and other organisations like yours and our own organisation, we see ourselves, we have lots of volunteers who are racing around trying to support clients, and we do a lot of work to ensure that all of our staff and everybody within our kind of network is absolutely doing something actively that's about looking after themselves. So things like mental health days, where they are able to and they're made to, in the beginning, because they won't do it. I can't do it because if I do that, then this won't happen and that won't happen. And it's really about enabling them to give themselves permission to access whatever it is that's offered. And as organisations, it's up to us, I think, to make sure that we have a full suite of offers, whatever it is. It could be something like, even something like a massage therapist, or something like that, somebody coming in and talking to them, offering them some form of counselling or something where they're able to just to go and have that kind of get all of this stuff out of my head because it's taking up too much space. A day where they do nothing, a day where they don't even go outside, they just sit on the sofa and watch a bit of telly, read a book. Giving themselves permission to do that is key. And I think that comes from the organisation because it's not coming from them. They will not give themselves. You're dragging them out screaming because it's like, no, I've got to do this, I've got to do that. So I think in terms of mental health overall, having a series of projects or programs or things they can access when they're ready, and then somehow giving them the ability to do that in a way that doesn't make them feel worse than they did for not doing it, if that makes sense. So I'm conscious of time, and I truly will talk about this all day. So there's a couple of minutes of my segment left if you've got any particular questions that either of you would like to ask.
I think that's really wonderful, Christine. In fact, thank you so much. I think on behalf of our members, the members that you've been working with through this time, I'm sure they're very, very grateful for everything that you've been doing. I think it's really interesting you mentioned about the dedication of the staff and our members, all of our members working in public services who have been really giving everything, no matter which workplaces they're in, whether they're in higher education, whether they're in a care home, in a hospital. We've really been going through the mill. Yes. And I think it's a really important point that so many of our members, because they work in those sectors, they feel very passionate about their work, and that to take that step back and to look after themselves has been a really difficult thing for many of them to do. So no, it's great to hear you speak about that. You mentioned a little bit about the kind of different kinds of members that have been attending the courses. Like, have there been different experiences from those different members in different sectors?
Yes, and also different experiences culturally as well, which has been very interesting as well, because all communities and all cultures are touched by bereavement, and particularly in bereavement, there are specific cultures with specific ways of managing the doing of bereavement, and that's been very interesting to see the impact it's had on your members because they haven't been able to do that. And it's particularly those members who are the ones that are saying the goodbyes for the family members, and then having to say to the family members, okay, we've given the opportunity to say goodbye on your behalf, but you still can't see them, and that's very, very difficult for members to have to be the people to say that to families, because, and we get this too on the telephone from our own side of things, the anger and the not understanding, and I think that takes its toll. Because it's not part of their ability and the work that they do is their human connection and their connectivity, and so when they're coming up against things that maybe they don't understand because it's not their culture, it's not their community, they're trying to then bring into that empathy that they have, and it confuses them. So then we become the people who shut down and don't say anything because we might upset you. And then they get confused about that because that's not who they are naturally. So I think that would be the biggest thing I've noticed is the variety of cultures that we have in this wonderful rainbow nation of ours, and each of us taking time to understand what the impact of loss is on them, and how we can kind of better serve them without making ourselves feel like we're letting ourselves down, because that's what I hear a lot. I know I'm not doing it right. I hear that so often, and it's not true at all. They're doing the very, very best they can in very difficult circumstances, but they've never been here before. None of us have, so it's a learning for all of us. So patience and empathy, I think, is the thing that I've observed in all of them, and a genuine kindness.
That's really wonderful. I think that you're right as well. And when you mentioned earlier about the kind of the nature of these courses becoming collective, and in some ways that kind of the collectivism of that grief in these cases and that bereavement, I think that's the power of the union as well, to bring those members together. And even though we're in a very, very new situation, we're in a place that none of us and none of our members have ever been in before. But the lessons that we've learned from like past action are really taking us into new places. So I hope that members will be able to kind of take those lessons of those collectivism and get more involved kind of within the union. I suppose, Alice, that gives us a nice segue into kind of some of the work that you've been doing, and hopefully be able to introduce yourself and some of that work more deeply. But you've really been doing a lot of work for a long time before this crisis in your branch, and in some ways that might have readied you for this crisis. I don't know if you have some reflections on that, but you've been doing a lot, so I'd really like to, Alice, I'll introduce yourself.
I'm not sure anything could have probably prepared us for this crisis, but certainly I guess some of the work we could have done, we've done, definitely had. So I'm Alice. So I'm the Assistant Branch Secretary at UNISON in Bristol, as well as the Equality Coordinator. And I work obviously in the University of the West of England in Bristol. My daytime job is a project support officer, but I've worked in a range of roles, mainly student facing up until recently. And I think, what we found with the crisis and how the organisation and our branch has had to respond is obviously very different from, I think, a lot of what we hear about the frontline services. But obviously the impact, some of the experiences that our members are facing, there are those similarities. We've had to change kind of the way we operate from head to tail, back to front, but repeatedly. When everything changes time on time again, often after rapidly changing and unclear guidance from the government, and that stress and fear that it's putting upon people can't be underestimated. And it's how we've been really working to really support our members but also with the organisation to look at what we could do. And I think that's from individual care. So I supported people returning from work who've been off with COVID, been really severely impacted by long COVID. So it's really seeing you just past that initial ill period, the impact goes on for a long time and can be really difficult for people, and what support we can provide when it's something that is relatively unknown still and the effects are still unknown is been a big challenge for people. But I think looking at what we've done, perhaps in splitting it down into the initial, the midterm, and the more longer term work, the background for, I guess, where the university and the branch has been is we've still had students living on campus throughout all the lockdowns, which I think perhaps vast majority of students will go home if they're able to, but not all students are able to. You have international students, care leavers, students who are estranged from their families, who don't have homes to go to, and it's really important that we are still there to support them. We had to set up things like a COVID support line, and we had changes to A-levels, which of course directly impacts us. Clearing dates had been announced. They're coming, I think they'll roughly be maybe a month earlier. That's not entirely set, but that has huge organisational impacts. So we're having to change things quite drastically, and not necessarily got the infrastructure or organisational setup to do that. So the work that then takes for our staff is really quite considerable. I think also UWI's had quite a broad community response. Probably the one that everyone knows about is the Nightingale Hospital, as well as we've produced, or our members have taken active roles in producing, antibacterial and hand gel for frontline workers and face shields. So, some people who have had day-to-day roles, maybe technicians in labs, have shifted and pivoted to respond to the COVID crisis, which is very different from what they would usually be doing. So it's that collective action and support and wanting to have that community response to help people, because we are all in this together, even though we may not work on that front line. Is what could we do to help, which I think was a really positive aspect. And then I think looking at what the branch has done, obviously we've, right at the start of lockdown, I think there was this kind of misunderstanding of what could be done to support people, particularly around reasonable adjustments and working from home. And, I personally had the phrase battered at me, I'm a disabled person, oh, we're all in the same boat and you've just got to make do. But actually it's, understanding that there's still that legal obligation to support your staff, and knowing you're going to be in this position for quite some time, and it's the ability from providing those adjustments gives someone the ability to work or not in some cases, and that having that ability to work, although sometimes it could be stressful, it's actually keeping that routine and that normality and connected with people is a massive thing. And a lot of our workers have been around supporting carers and parents. So one of the things we worked with the organisation or the university on was shifting our focus from hours sat at desk to output, because I think we've been quite stuck in 9 to 5, you sit at your desk, not what's actually able to be achieved, or maybe working like non-standard hours, if you would. So from maybe like 8 till 10, and then you've got caring responsibilities, and then maybe picking up a bit later in the day, and that's all things that have seemed so unattainable for us to do previously. But we've had this shift where we've been forced to work more creatively, and I think it's something that if we can look for positives from the pandemic, hopefully these are things that we can continue to embed and work, because it means you're in such a more inclusive environment for people and focusing on individual needs rather than blanket statements of what can and can't be done. Obviously we've been supporting our members with financial difficulties, helping to get agreements in place for supporting staff as a whole, down to getting equipment out to people. I think then, as we've shifted more, past that first initial lockdown where everything was really shut down, we had to really swap into looking a bit more forward thinking. So that's, not just creating a safe working from home environment, but it's acknowledging not everyone has a safe working at home environment for many reasons. It could be domestic abuse, it could be not being able to have those reasonable adjustments at home. So we worked with the university to ensure that there was support in place for those staff, not just people who might need some equipment at home. It's that balance and recognising everybody's experience, not just the main. As may be expected, our huge focus has been working to secure COVID secure workplaces. So we were meeting with the university weekly, but also we went to every single sign off of each area, looking at what needed to be done before it could be confirmed as COVID secure. And sometimes that was having to make the hard decision for the safety of our members, saying actually we don't think this is ready to be signed off, it can't be. Or some areas, if our office didn't have windows, saying this can't be used for the duration we're in that, and that means you've got to look at how you use your space differently. And really keeping in contact with our members, I think, was really vitally important with that process of signing off areas as COVID secure. We were finding a lot of members were being told that areas were being signed off, but there wasn't any clear information coming out from the university as what was signed off when inspections were planned. So we created a web page on our website so members could clearly see what was agreed as safe, when other inspections are planned, and if any areas weren't signed off or we said weren't safe to be. So it was about giving that reassurance to truly help remove some of that in a really fearful time. Recognizing we can't take it's an unknown situation, but what could we reduce some of that stress and people's well-being? What influence can we have when there's so much going on, cutting down at what our priorities needed to be? I think we've had extra layer of complications, I think it's fair to say, somewhat unconnected to COVID, but it's all a big mishmash of Brexit, of course, is increased complexity for us, and quite a lot of times having to change visas, obviously for EU students, or the Erasmus scheme. And so that's meant, on top of already having to change what we do organisationally, because of COVID, we've got this extra thing to think about at a time when we've already got workloads that are really quite high and really stress individuals. And also, I guess, supporting what we're doing, there's been an increase in volume of work, but the complexity of that, being able to support students who are suddenly spread across not just the whole country, but the world, means that our staff members have, what might take, say, a 5-minute job usually might take an hour, because it's got all of these extra things that you have to think about. And that, I think, is where we've come in as a branch, is actually looking at the stress on work and again focusing on that output. What can we do? Are there things that we could maybe focus on and not do other things, so we could really support people in giving that ability to not overstretch themselves and say, actually, I can't do that, I need to step back. It's that, I guess, empowerment for individuals of saying, I can only do what I can do. And we were, I guess, quite lucky in a lot of areas that was taken on, really well. I think, we've not been without challenges, but I think it's, I think it's about being able to do what you can in the most difficult of circumstances. And I think tying in the work that we've previously done and the input that could have is, so we've done, we've negotiated specifically on mental health policies before. So that's on UWE's mental wealth strategy. Our Vice Chancellor is the chair of Universities UK Mental Health for Higher Education Advisory Group. It's a bit long. So, you know, we've taken an active role, not just engaging on those, but also on policies that are really important for good mental health as well, and well-being. So that's, you know, maybe outside of what you would automatically think of. So that might be a piece of work we're doing at the moment is on a menopause policy, because that has a huge impact on, you know, people's mental health when you're going through menopause, and not having, you know, clear support or guidance available to people could, you know, have a massive impact. Big work we've done previously was we negotiated a support service for disabled staff as well, and so that is we have an outside organisation called Wessel who you can go to get support for reasonable adjustments, and that's outside or more than just that physical equipment, which often we see with, you know, occupational health focus on that, you know, physical equipment side of things, but also having conversations between members and the managers about, you know, what can be done, you know, what's the understanding of the condition, to try and get, you know, group agreements where sometimes, you know, the manager might not understand a lot about the condition or what their responsibilities are. And we were really successful in being able to get disability leave policies for the university, which is a huge win and makes a massive difference, that, you know, staff don't have to worry about taking their annual leave to go to medical appointments if they're disabled. So then they actually have their annual leave to be able to do things, you know, look after their health and well-being, and, you know, take some time out to really de-stress. We're doing some really exciting things at the moment around bullying as well. So obviously that's something that can really massively impact your mental health, and it's about having, you know, someone who's an impartial sort of investigator almost, who can look at both sides of the coin, and it's really to, you know, determine what's happened, what needs to be done, and support the individual, which is something that we've kind of missed before. And hoping that having things like this all in place, having a menopause policy, you know, really good policies for disabled staff, the bullying working group, all of that collectively helps improve your working environment for members, which has that direct impact on people's, you know, mental well-being and mental health at work. But it goes beyond that as well. So it's not just ensuring we have those policies, it's ensuring they're fit for purpose, they're inclusive and representative, because one of the things that, you know, I'm hugely passionate about, and the branch is hugely passionate about, is, you know, the impact of those policies not being diverse and inclusive has a massive detrimental impact on staff experience, mental health and well-being. You know, bluntly, it's erasure of people in the, you know, the bluntest sense. That was one of the things we're, you know, core to our menopause work at the moment, is it's not about that 45 to 50-year-old, you know, white women experience that, you know, we quite often have in other policies. It's about people who menstruate, to recognise that whole experience, not just the majority, and that's vital to, you know, creating that inclusive workplace for people, so it is a well workplace to exist in. And as well, we have the belief policies are great. They're not to be poo-pooed, they're not to be underestimated, but a policy is only good as its application and the culture of the organisation. So I think we have some really great policies, and we sometimes have that challenge of, you know, getting that applied or ensuring that it's equitably applied for all, because if it's not equitably applied for all, that creates divides, it creates, again, a huge impact on people and their mental health. So it's, you know, we definitely take that approach about going beyond, let's look at mental health. It's across, I guess, what you look at all of those other factors that collectively impact on people's lives. So yeah, and then we're looking at, I guess, what else can we do? What have we not got? And I think
that was going to be my question for you, Alice. Is like, what do you see coming next in this? Because I think it's really exciting to hear like the amount of work that you've been doing in the branch, and that you've been supporting members. I think like your introduction there it really illustrates the stress that our members have been going through, whether that's been they've been working on the front line, they've been supporting students through a new way of working, a new way of living, or that they've been having to work at home, and sometimes home isn't a safe place for everybody. I think that's really a really honest and difficult kind of position that lots of our members. Yeah, how do you do that? What's next? How are you going to take that forward as a branch?
Yeah, I think, firstly, it's touching on a bit about what you said is, we don't all work on the front lines, and, the impact of people working on the front lines is huge. But actually, you don't have to work on the front lines to be hugely impacted by COVID. You don't even have to have had COVID, don't have to have known anyone who's got COVID. But we're in such difficult times that actually it's so important for people to, recognise the importance of staying mentally and physically well. And I think some people, it's having the acceptance that that's okay, that it's not a suffering Olympics of who suffered worse. If you don't feel right and you don't feel well, that is how you feel, and that is okay. And I think that's a focus really for when supporting individual members at the moment, but also going forward. I think it really translates to a post-COVID environment, because we know that we put such an emphasis on staying physically well. And if you don't feel, if you've got a bad knee, you'll go to the doctor about it, or if you've got a cold, you might go to the doctor. But when we feel maybe physically, mentally unwell, what we do tends to be maybe less of a priority, or we take less steps. It's not seen as important still. We talk about it a lot more. I think what we could do in an organisation, I'm quite interested in, I know it was mentioned earlier about, mental health days. We have sick leave, and I think there's still that opinion that you can't really take sick leave, or if you don't feel mentally well. It's not, I think, still so widely acceptable. Or with sick leave, you have to come back in, you have to tell your manager what's going on and justify it, and sometimes that can be quite a challenge for people to overcome or to face, so they might not do it. So is there the ability to have mental health days that you take, not necessarily even when you're feeling your well-being is really suffering, but as a proactive step to prevent that, to be able to come in? And that might be taking one day off to have the space, as you said, to sit on the sofa, read a book, get out, have a walk, means that you're not going to then need a week off, because you're preventing that burnout. I think that's something that I'm really interested in, because I think looking at what we do in the coming year for the branch is, how do we facilitate people to take that proactive step with managing their mental health, but getting the organisation to culturally change to allow that, because it's not, the emphasis isn't just on the individual. I think it's it's having the organisation allow that and facilitate that in more than saying
Christine in here. You just put your hand up, Christine. Do you have something to add? Because you mentioned mental health days when you spoke.
I was just kind of thinking about what Alice was saying there about individuals and having this idea of mental health days, which I'm absolutely 150% behind, and I completely agree with you that it is the organisation, as much the organisation's role to enable that to happen in a way that doesn't make people feel less than. The challenge we have, and this is again my observation of your members, but not only your members, but people who work in these professions, is they don't know that that's what they need. You know, they know that they've got a headache, or they know their tummy hurts a little bit, or they know they feel just a little bit off. And so it's going to build and build and build. And then at some point, they're going to go and see a doctor, and then they might get some medication, and then that's not going to help. So it could be quite some time down the line before they absolutely recognize actually what's going on here is emotional stuff. And so how do we stop? How do we get that before that? I think that's the challenge. And maybe it's the language around it. You know, I'm all about mental health, but I also recognize that that word in itself creates a thought process that says, oh, I don't need a mental health day, absolutely fine. You know, so the language and how we talk about emotional health and how we engage your members and all of us really in the language of thinking about what goes on in here and how that impacts us physically and emotionally. It's something around that. I don't know the answer. You know, my way of working with it is trying not to use language that makes them feel less than, because historically this country, like most of the world, sees words like mental health and thinks, oh, you know, and it becomes language that's used to describe something that makes somebody feel less than. And so it's thinking about ensuring that what we create to support your members doesn't do that. I'm aware we've got 5 minutes and there's some questions. So, sure.
Yeah, that's okay. I was going to jump in there. I think that's perfect time actually, because one of our questions is around kind of improvements that you see, kind of how we might come out of this crisis in a positive way and really make the most of a difficult time. And maybe that's through technology, maybe that's through negotiating mental health days. Do you have any contributions around things that you think that could make this period better going forward?
Yeah, I think there's lots of things that we've seen could be positives, but I think it's in the application to show. I think a bit like I said earlier, it's ensuring they're applied equitably and inclusively. So for lots of people working virtually, while you know there's increased fatigue, it gives greater flexibility, but that isn't the case for everybody. So at the moment, I think we're trying to improve on that. But we're also kind of constrained by the pandemic in lots of ways. And if we're looking at how we might embed things going forward, it is paramount that it's not one size fits all, or forgetting, you know, the experience of people who actually have had further barriers put in their place through working with technology. So I think, you know, there's going to be greater flexibility in a lot of places, particularly in universities, to be able to work more from home or have a hybrid kind of working between home and office. But it's how that is applied that doesn't create further barriers for people. I think is, you know, I don't have the answers for that yet. I think we're really early into our experience of it, but definitely is one of those. Yeah.
I would agree, just very quickly, I would completely agree with what Alice is saying, and I would add that the key thing that we've learned that works is giving people choice. You know, when you give somebody a choice, and you enable them to find a way of working in a way that works for them, we all know instinctively that everyone's going to perform better. Now we actually know it because it's happening. Because what I'm seeing with your members working in the way that they're working is they're giving 150%, and they're not working the way that they did 12 months ago. So I think the advent of choice and the evidence that we have that says if you give the people you want to keep and retain choice, they will be with you for life, and they will be loyal, and they will do the very best that they can. It's when you put us all into little boxes, metaphorically speaking, that we start to kind of not sure about that and nudge our way out of it.
Chris, just another question, Christina, is around, do you think that from the experience that you've had with members, do you think that employers have been doing enough to kind of support staff through this difficult time? What do you think that employers could be doing more to support staff through this?
Honestly, I think everyone's doing the very best they can, you know, and I think that's true of wherever you are in the organisation, because we are the question I'm seeing on the screen is, are organisations providing staff and students with sufficient bereavement counselling? In my world, you can never have enough of that. So the answer is always going to be no. But I think what I'm seeing with your members and your member organisations is a willingness, and where there's willingness, there's a way through. I'm not hearing stories that say, oh no, we can't do that because, the conversations are, oh, you do that. Okay, I'm going to go back and talk to my people about that and see how we can kind of how we can kind of engage with work in that way. So I would say overall, yes, everybody is doing the very best they can. And I haven't got one example of anybody saying, I hate where I'm working, they're being really awful to me. Everybody is recognizing where we are and that everyone's doing the best that they can, for sure. That's my experience of it anyway.
No,
and you can definitely do more around bereavement counselling. I mean, Cruse Bereavement Care is not the only one out there, believe me. There's lots and lots of organisations out there. Child Bereavement UK, there's so many. Winston's Wish, the Good Grief organisation, and all of us are there for you. So, access it. I think that's the key. Sometimes we don't know where this stuff is. And so I always guide people to our website because you'll find pretty much whatever you need on there. So I would say the answer is you could do better, like all of us, and it's there, and please access it.
No, that's great. I'm going to take this time to kind of draw to a close. Thank you both so much for coming, for sharing your wisdom, what you've learned so far, and the things that you continue to learn. And thank you for supporting our members. It's a really, really difficult and trying time for lots of people. So yeah, thank you both. Thank you for joining us. Thank you for people who tuned in and listened. I'm just going to show a quick slide. Hopefully people can see this, and it's just a quick piece of information about resources. So if you're watching this and you're a member, please go to the LAOS website, learning.unison.org.uk. There's lots of events on there, details of courses for members, for activists, and there's some resources on there as well for mental health and wellbeing. If you're interested, if you're wanting to run something in your own branch, please get in touch. As you can also have a chance to attend one of Christine's courses. There are 3 dates available for the next round of Cruse Bereavement Care courses through UNISON, if you're a UNISON member, and the dates are there. If you're a branch activist, you're interested in developing new mental health policies or working with your employer on this, we do have a great bargaining guide, and it's due to be updated very soon with extra COVID related guidance. So when that comes out, please check our website, keep looking, it's due out very soon. And finally, there's a great resource that the TUC Young Members Committee created in the summer, and that's called Resilience to Resistance. And it's around organising and campaigning for better mental health and wellbeing at work. There's some really great recommendations and resources there. I'd really kind of urge you all to have a look at it, familiarise yourself with it. And just wait to say thank you again, and thanks for having us. Thank you very much.
Thank you very much. Thank you. It was lovely to meet you all. Thank you.